Hello everyone, welcome to the workshop. My name is Faisal Jahangiri. I'm Vice President of Clinical Affairs at Access Neuromonitoring. Today we are going to talk about Brainstem Auditory Evoked Potential setup and recording. Brainstem Auditory Evoked Potential, they are performed in order to minimize hearing loss during the surgical procedure. The surgical procedure involving the 8th cranial nerve or facial nerve, they have a high risk of hearing deficit. So performing and giving a feedback to surgeons is very, very critical during this type of surgical procedure. The setup is simple. So we have to use 3 electrodes for recording. A1 is used on the left side anterior to the ear on left tragus, A2 on the right side and front of the ear, and we do CZ on the head. The CZ scalp electrode, CZ is again according to 10-20 system, is measured a midpoint between nasal and inion, 50% of that point. If the surgery is being performed at A1 and A2 level, we can place the electrode in alternate side that's behind the ear, which is M1 and M2. M1 is the mastoid process on the left side, and M2 is the mastoid process on the right side. For stimulation, we use 2 type of tubes, the extension tubes. The blue tube is used on the right side, the right tube is used on the right side. They are connected to ear inserts. The ear inserts come in 3 different sizes. One is gray, which is pediatric, and the other adults are in yellow color, but there are 2 sizes, small and large. And depending on what type, how big is the ear canal, you can select either pediatric or medium or large adult size. The key point here is to make sure you, once you place all your stimulation electrode and recording electrode, you secure the electrode and make sure the tube is not king. If the tube is king, it's going to block the sound conduction and you will not be able to get any responses at all. We can also do recording from tympanic membrane. It's known as electrocochleogram. That's a peripheral response recording from the cochlea. In order to do that, either you can put a cotton wick electrode soaked in saline next to the cochlea before you put the ear insert, or you can use a gold foil electrode, which is a gold wrapped around the foam insert, and you can record from there too. So that's a second recording, and it gives you information about the blood supply. So if you want to do auditory evoked potential in the OR, try to do a peripheral response, which is electrocochleogram, and do at least 2 channel of ABR recording from A1 CZ and A2 CZ. The final thing is have to make sure the alert criteria. The alert criteria is if there's a half millisecond delay, you have to alert the surgeon there's something wrong, because if the delay is stayed there, patient, even the nerve is not damaged, patient will wake up with a deficit. So half millisecond is alert criteria, and if the delay of the waveform is more than 1 millisecond, then it's intervention. So you have to stop, or you have to inform the surgeon, they have to remove the detector or do something so the signals come back. So that's a very important key factors or key point to remember.